All right, guys, thank you so much for tuning in. It is Sarah at carnivore.yogi. I have a really special guest here today, somebody that I've actually worked with personally offline quite a bit. And she and I have messaged virtually several times over my own data using my continuous glucose monitor. And so it's really exciting to have her here with me. It's Kara with NutriSense. So Kara, why don't you just kind of introduce yourself, talk about your background, certification, all that stuff.
Yeah, definitely. So I'm a registered dietitian and I started my career in the hospital system. So I was actually working in an ICU with critically ill patients. So learned a lot in that. So 3 big takeaways was that I was seeing people way too late, trying to change someone's lifestyle habits after they've had diabetes for 30 plus years and now they're coming in with a diabetic complication like a foot amputation is really difficult. So seeing people way too late, that was frustrating. And I was also realizing that the hospitals are really not great at preventative health or treating the root of chronic diseases. And then I was also noticing that glucose was at the core of all of these conditions. So diabetes, heart disease, kidney disease, dementia, all of these have to do with our metabolic health.
Wow.
So with my experience from the hospital as a dietitian, I started the company NutriSense with 2 other co-founders. And what we're doing, which we've worked together through NutriSense, is that we use continuous glucose monitors, which are normally a medical device for insulin-dependent diabetics. But instead, we're using this on non-diabetics in order to prevent chronic diseases like I was seeing in the hospital. So it's in reaction to all these real problems I was seeing in the real world. And now we're using this data so people can be informed about how their bodies are working and actually take control of their health from an earlier stage rather than trying to fix it when it's way down the road. So that's where I'm at now. And it's been awesome working with you and a lot of other people taking care of their health.
Would you say like a lot of the people that you have been working with are keto or low carb or carnivore audience?
Yeah, I would say at least 50% of our customers fall into that category. So we tend to have 2 buckets of people who are interested. One is, somebody who's low carb, keto, already really interested into the health world, but wants to know specifically what's happening inside their body. I think you've learned this, we're all really different. Yeah, some people respond really well to high fat or high protein or fasting or eating more meals in the day. So we're all really unique. Our bodies are personalized. And so that helps you to figure that information out. And then the other customer type we have is somebody who's maybe on a little bit of a health bubble. So pre-diabetic or overweight, high fasting insulin levels, somebody who knows that if they don't do something, they will end up with the diabetes, heart disease. And so they're kind of taking charge before it becomes too late. So
Got it.
An awesome experience.
Got it. Well, so Kara's awesome, you guys. She's super responsive. I have used the continuous glucose monitor, I think 4 times now, and I've got another one in there that I'm going to strap on probably in a couple weeks. I'm kind of letting my stress. I've had some a stressful couple weeks here. And as I mentioned in a previous video, your stress levels are absolutely going to mess with those numbers.
Yes.
But what I would love to talk about for people watching, just kind of the topics that I want to look at in the conversation. One, I want to hear, especially right now, relevancy of people, and we don't have to mention the name of the little slamdemic going on right now.
Mm-hmm.
YouTube loves to censor that. But I'd love to talk about blood sugar in this relevant time. And then I would also really love to talk about, since you have been with NutriSense, working with so many keto, low carb people, different things that you're seeing, people on my channel are very familiar with my journey of, eating a higher protein carnivore and seeing my blood sugar spiking in the night and those fasting numbers being a bit higher, and now doing a high fat version, my numbers are down a little bit lower and my fasting numbers are way lower. So I'd love to dive into that stuff and maybe even talk about differences in fasting for women and men. So a lot of stuff, you guys. But let's start off with talking a little bit about relevancy of, why should people even if they're not keto or low carb, why should they care about their blood sugar numbers right now with this kind of global event, I guess you want to call it, going on right now? What's the relevancy?
Yes, I would say now is even more important to make sure you are metabolically healthy. So there's a huge link between our glucose control and our immune system. Our lifestyle habits are very related to chronic conditions, and having a chronic condition does suppress your immune system. So now is the time to get metabolically healthy. Right now, as things are going on, people with pre-existing conditions are at much higher risks to have poor outcomes. So that includes diabetes, heart disease, chronic kidney disease, obesity in general is also a risk factor. And all of these chronic conditions have glucose at the root of them. So glucose isn't just something that increases our risk for diabetes, right? We always have some glucose in the bloodstream. Our body works really, really hard to keep it in this very normal homeostatic range. So about like 70 to 90 if you're fasting. Body wants that to be in that range. So when it starts to get pushed above this or below this, that's a signal that your metabolic system is working really hard to get it back into that normal range. Something's going off, and maybe, that's eating, and that's normal. It's normal for the metabolic system to be pushed a little bit higher when we're eating because we're processing that food. That's a little bit normal. We don't want it to go too high, but having that glucose in that tight range gives you an indication of what's happening on the inside and how your body is functioning. So specifically related to glucose and the immune system, high glucose levels, eating without a diagnosis of diabetes, just elevated glucose levels for whatever reason, maybe you went off the rails a little bit with some sweets, or maybe you're really stressed and they're high. This affects our immune system. It alters the innate immune system inside of us. So these immune cells, like white blood cells, neutrophils, they get altered to deal with the high glucose levels instead of dealing with any sort of risk or virus that's coming in. So it's suppressing our natural immune system, and so it's making us more susceptible to getting sick. And so then we also have these inflammatory markers like CRP, fibrinogen, that increase in response to glucose also makes us more susceptible to getting sick. And so elevated glucose levels also suppress our antiviral immune response. So all of this can compound together and make us much more susceptible.
Wow.
So it's very important right now to be metabolically healthy. That's probably the best thing you can do to prevent getting sick, right? Is making sure everything's in check. It's not going to be taking 2,000 milligrams of vitamin C that's going to protect you, or necessarily, these other precautions that we do that are much easier. What's actually important is taking care of yourself holistically and making sure the systems are working appropriately.
Awesome. Yeah. And so I guess what kind of trends are you seeing people right now? I know this is a kind of a different question, but are you seeing people with a little bit higher glucose levels right now, just overall, I think as a response to stress and kind of what's going on globally? Yeah.
Yes, I am. So I think it's important to remember that having a normal stress response is appropriate, right? We have evolved and adapted to have a stress response. When we were threatened with something like a tiger or having to fight off something, then we want that stress response. So when our body sees a threat, we release cortisol, we release adrenaline to help us cope. So this is our fight or flight response. But this also triggers glucose production in the liver. So it's telling our body, hey, we need a little extra energy to deal with this stress. Here's some extra energy. And it also reduces our insulin sensitivity so that glucose doesn't get cleared away from the blood and it stays in the system, so we have energy to deal with this stressor. So that's appropriate, but what's supposed to happen is an acute little stressor and then increase in glucose, decrease in insulin, and then we deal with it and then it comes back down. The problem is when we have chronic stress, right? So ruminating over whatever fight you had, reading work emails way into the night, all these stressors that our body really isn't prepared for, dealing with real stressors right now that's happening with the pandemic, that yes, it is real stressor. Like people have lost their job, money is at risk, we're stuck at home, how are you going to take care of your children? These are real stressors, but our body recognizes it inappropriately. So when we're chronically stressed and cortisol is always elevated, we have this high level of fasting glucose all the time. And that's totally not normal. So actually, because we saw me and a couple other dietitians on our team, so much stress increase with this, we sat down and talked to a stress therapist, a psychologist who specializes in this, because we wanted to be able to talk to our customers and say, how do we deal with this? And how do we bring that glucose back down? You know, I don't deal necessarily, it's not my specialty to do stress reduction, but I'm seeing it so much. So a very useful tip that she said that I could pass along here, coming from her and not me, is that, you know, we have this vagus nerve that runs in the front of our body. And so physically thinking about the three areas, you know, the face, the chest, and the belly, and physically relaxing those, letting your face relax, letting your chest relax, and letting your belly relax, is enough to stimulate some of that parasympathetic response and lower the cortisol and bring that stress back down. But it's been a huge problem. So you're not alone in having glucose come up with the stress. A lot of people are dealing with it. So
yeah, and it's funny because I'm a yoga teacher. I've been I know this is like a food blog and everyone just likes to hear about what I eat, but I've been teaching yoga for over a decade.
Yeah,
I teach breath work. I know extensively about the vagus nerve, you know, and how it's like 11th
breath work is
nerve.
huge.
It attaches to diaphragm. So anytime you can breathe diaphragmatically, breathing in and out of your nose, all that stuff to help get your body into that parasympathetic state. Like that's what I do. And I've been blessed to be able to still offer services virtually to people right now, online classes. I just did a breathing workshop on Sunday, but it's almost like people right now, they're so stressed out that they even have a resistance to learning some of this stuff or to even doing it. It's like,
which I think is why having some of this feedback from your body in the form of glucose is helpful, because stress feels like this very intangible thing where it's like, I'm stressed. How do I deal with this? And it just feels like something that you can't quite quantify. But when you can see your glucose rise in correspondence to the stress, it becomes easier to be like, oh, I see that, I'm going to deal with it. So having that mind-body connection through a metric like glucose is really helpful in being able to take charge of that, because otherwise it is hard. It's something that people are like, I'm not sure it's making that big of a deal. Yeah, I'm stressed, but it's fine. It's like, actually it's making a huge deal. Like it's affecting your whole body for sure.
Yeah. And what I ended up having to do, and I will link you guys below the video that I did, where I talked about like a lot of stressful things that happened to me the first week of all this. And I had my monitor on, I had that feedback of like my numbers being way higher than they should have been with what I was eating. But what I actually had to do was go talk personally with my meditation teacher. And I got a couple of practices to do on my own. And I did those practices, you know, I'm not saying you have to do this, but I was doing like an hour a day over what I usually do, which is usually 40 minutes a day. So I was doing like an hour and 40 minutes a day of these practices to get my nervous system rebalanced and to calm. And within a couple days, my numbers went back to normal range. But I think if I didn't have those practices and kind of like the knowledge that I do, then I would have, I'm sorry, that's my daughter banging in the other room. Talking about stress right now. Oh my God. Glad I don't have my monitor on right now. I probably would have just shut it. But without those practices, then I think that I probably would just have stayed at that chronic stress level. So it was great feedback to have.
Yeah, that's an amazing that you were able to bring it back down with that too.
Yeah.
And I think it's something where we always talk about, the diaphragm is a muscle we have to train just like we train our legs at the gym, right? So it's something, again, where with physical activity and exercise at the gym, you can see the benefits right away, but it's harder to see those benefits of training the diaphragm, but it's just as important. So we have to keep remembering that it's just as important as training any other muscle system.
Absolutely. Absolutely. So I guess what I also wanted to ask you about, what we talked on briefly in the beginning, is people doing carnivore and possibly seeing higher glucose numbers overall. Talk about that. And then kind of my situation, we talked a little off camera before this, people seeing those numbers kind of shooting up in the night. Just kind of what you're seeing out there, what your thoughts on that are. If we can dive into that a little bit.
Yeah. So generally, we're looking at 3 different trends when we're analyzing our glucose data. So one is our fasting glucose levels when we haven't been without any food, and we want that typically between 70 to 90. If you go to your doctor and you get a fasting glucose taken and you come back with about a 99, they're still going to call that normal. Anything between 100 and 126 is pre-diabetes. So anything under 100, they're like, okay, you're good to go. But based off of the research I've done and we've seen, there's actually a pre-diabetes between 90 and 100. So we really want to keep it below 90 in terms of health optimization. Not, again, the hospital system, the healthcare system isn't necessarily looking at health optimization, right?
Right.
So we want it to be below 90 most of the time. And then the second trend is postprandial. So after you're eating, we want to avoid spikes above 140. And then the third trend is glycemic variability. So that's just the swings in your glucose, how much you're going up and down. So we monitor that with standard deviation. We just want to keep generally stable glucose levels and no major ups and downs. So somebody who's following carnivore or keto, they're likely not having big spikes in glucose and they're likely having pretty low glycemic variability. So those two are typically pretty good. Where I see some variability or room for improvement is with the fasting glucose level specifically for this audience. So especially in the middle of the night when it's hard to measure, right? So most people aren't waking up in the middle of the night and checking their fasting glucose levels with a glucometer. That would probably be counterintuitive because bad sleep also affects your glucose levels.
Yes.
But so it's really hard to see this, and so this wasn't very well documented in the literature because most information on continuous glucose information is on diabetics. So we started seeing this over and over that those fasting glucose levels were really high specifically in this audience. So started to dig into this deeper and figure out what's going on. And what's happening is called physiological insulin resistance. This is what's happening most of the time. So if you think of traditional insulin resistance that you might see in a diabetic, our glucose levels are high and our insulin levels are high. So our body keeps pushing out more and more glucose to deal with these more and more insulin to deal with these high glucose levels, but the cells aren't responding to the insulin for whatever reason. So you end up with both high glucose levels and high insulin levels. In this audience, typically what you're seeing is you're starting to see this rise in glucose levels, but you should see still low insulin levels. So I always recommend everyone who's following keto carnivore to get a fasting insulin level taken every 6 to 12 months, just to make sure that, you know, if your glucose is kind of high, that your insulin is low. So what seems to be happening in these people is that it's called adaptive glucose sparing. So the body starts to get really used to using either fatty acids or ketones for energy, and it starts to refuse glucose a little bit. So it's a process that happens at the cellular level where the body, the mitochondria are processing these fatty acids and ketones instead of glucose, and then this changes the metabolic pathways. So then the pathway that processes glucose gets shut down a little bit. And the muscles specifically go into glucose refusal mode, and they only want fat or ketones for fuel. And you can see this if somebody takes an oral glucose tolerance test, which is where you drink 75 grams of glucose, and then over 2 hours, you just watch your glucose. If somebody who is keto or carnivore takes that, they're probably going to show diabetic levels because they're having this temporary insulin resistance. So glucose is going to shoot up. And you can prevent this by 3 days before the oral glucose tolerance test. You have at least 200, 150 grams of carbohydrates every day. And then you retake the test and you have normal results. So this is a temporary adaptation where the body is refusing glucose a little bit because it wants fat or ketones more. So this is a little controversial of if this is a good thing or a bad thing, right? So there's tons of evidence that show glucose levels above, fasting glucose levels above 90 have worse outcomes. It's an increased risk for cardiovascular disease. It shows some sort of beta cell impairment. So there's all this research that shows we don't want a high fasting glucose level, but then we're seeing high fasting glucose levels in this specific audience with a low insulin level. So it's sort of up in the air. Is this a good thing? Is this just a natural adaptation, or is this a bad thing? And what we've started to experiment with those who are doing keto and carnivore who want to try fixing this is, first of all, making sure stress is in check, right?
Mm-hmm.
That could be the main reason your fasting glucose level is up. Making sure that your sleep is good. Sleep can make our glucose go up.
Mm-hmm.
Making sure you're not eating too late. So our insulin works on a circadian rhythm, just like melatonin. So if you're eating really late at night, regardless of if there's no carbs, regardless if it's meat or whatever it is, if you're eating late at night, that's going to increase our glucose levels because our body is not naturally ready to process food late at night. It's just not the way our insulin system works. So we're more insulin sensitive during daytime hours, less insulin sensitive at night. So those are 3 factors that we want to make sure aren't happening. But then if all of that is looking good and we're still seeing high fasting glucose levels, then we try some carb up. So I actually have talked to Carnivore MD about this because he uses honey every once in a while.
Yeah, I saw that.
Yeah, he's been able to lower his fasting glucose levels that way because the body sees, oh, every once in a while I'm getting glucose, so I'm trained to be able to use both. That's one way to do it. Another is just altering macros, which seem to work for you, if I recall correctly.
Good for me. Yeah.
So for some people, it's that the protein is too high and that's stimulating some extra gluconeogenesis, and maybe we need to up fat. And for some people, actually, it's the opposite. So if they're really high fat, and then it just seems to be that there's some genetic variance there that some people just don't tolerate high fat as well. And I think there's some sort of inflammation going on in those people. And then when we increase protein and lower fat a little bit, then it improves for them. So it requires some experimentation, but I think at the end of the day, that's something very important for everyone to remember, is that we're all unique. Our bodies are all different. And so you have to experiment and figure out what works best for you. Make sure there's none of these big red flags going on, like stress or poor sleep or eating poor quality food too. So dirty keto or dirty carnivore, that actually has an effect on your glucose. I've seen that where we're just eating like deli meat and, hot dogs, and cheese.
Oh, yeah.
Yeah, that's going to have an effect. Like your body knows. They're like, this isn't real food. Like I've seen this.
Yeah, exactly.
So we have to make sure those things are in check. But then once you've, checked all the main things, then it's time for some self-experimentation if you're still not seeing the results that you want.
So you're saying insulin levels are still low. This is what I've seen, and this is why I test my own A1C. And you guys watching, I'll drop a link below if you want to test your A1C, which is that fasting insulin, correct?
Or glucose. Yeah.
Glucose, I mean. I saw my A1C when I was doing super high protein actually go up into the 5s, and it had been kind of down in the 4s for a while. So I was like, what? So what would you say to somebody who they've tested their A1C, and let's say it's like not diabetic, but it's, it's like in the upper 5s, like 5.6. And then they're also having those higher blood glucose numbers on their CGM. What would you say to that particular person? Should they be worried or no?
Yeah, I would say that's a signal to try some experimentation, see if you can bring that down. So that's in that range where, we're not at pre-diabetes, we're definitely not at diabetes, but we're at that like yellow flag zone where I'm like, okay, now's a great time to experiment a little and see if we can bring that down. It's not gonna kill you right now. Like it's a good warning sign where you're not gonna have a ton of damage at that, but we wanna bring it back down. Yeah. So a reason why I like to have all these different glucose metrics and other lab values like the fasting insulin level, get your lipids checked also, get your thyroid checked, cortisol. But, fasting glucose tells you this snapshot in time. It tells you what's happening when you're fasting. We're fed a lot of the time, so it doesn't tell you everything, right? And an A1C tells you your average glucose value. So it's not always telling you your ups or your downs. And it's just kind of giving you a general 3-month span, because it's telling you how much of your red blood cell has been glycated with sugar during that lifespan of the red blood cell, which is about 3 months. So there's some flaws with an A1C that some people should be aware of. If your red blood cells, for whatever reason, don't last 90 days, then it could be falsely high or falsely low. So if you have anemia, it's not going to be accurate because your red blood cells aren't the same as the standard red blood cell. So those are a couple things to keep in to mind. So there's always flaws with some of these tests. That's why we want the more testing, the better, right?
Yeah.
No, yeah. Get your data and check out all, a variety of labs, know what's happening on a continuous basis. That's why I like the CGM, because it can tell you some of these things that you miss on these other metrics. And so it's just a time to experiment if you're seeing something off. I always say if you're doing everything to a T, following something exactly for 3 months and you're still not seeing the result you want to, try something else. Because just because it worked for your sister or the person you follow, on social media does not mean it's going to work for you. So if you're really giving it your all and you're not cheating and you're trying it and it's still not working, try something else. Like a lot of people get stuck on this, like this thing has to work, or like this specific macronutrient ratio has to work because it worked for so many other people. We're all different, and it's super important to recognize that at the end of the day.
Absolutely. What do you see with fasting? People who are doing a lot of fasting, extended fasting, even the intermittent fasting, how are their numbers looking? Because everyone always kind of preaches about how fasting is going to be this magical cure to lower those numbers. And for me, I actually saw kind of the opposite. It was when I was doing a lot of fasting and intermittent fasting, like very strictly, that I saw the higher fasting numbers, and I saw the numbers kind of shooting up overnight. Now, again, that could have been higher protein, but I was cutting off my eating window every day, 5 o'clock or earlier. Then I wouldn't eat again until, noon or 1 o'clock the next day. And I still had those like super high, for being keto or carnivore, what I consider to be high numbers in the 90s, 100s. So what are your thoughts on that trend?
Yeah. So you were eating about a 4 to 5 hour window?
Mm-hmm.
Okay.
Sometimes 6, but definitely not anything more than a 6 hour.
Yeah, that tracks with what I've seen. So I have a lot of things to say about fasting. But so what was interesting is going into this, before we started actually seeing customers' data, digging into the research, doing everything we can to build up educational materials, learn everything we can. And there's not a lot of information about healthy people and continuous glucose data. And most of this research that's been done on fasting has been done on men, right? Women are excluded a lot of the times from research because we have periods, and that makes us complicated.
That's what I try to tell people all the time is like when you're in reproductive age, there were actually a bunch of laws that were created so that you cannot run a lot of medical tests on women of reproductive age because they don't want you to get pregnant and be in this clinical trial and then have a risk to the fetus,
Yeah.
I don't think women really understand that.
Yeah, most people are not digging deep into the actual, methodology of what the research was. They're just looking at the quick conclusion. So that's the first problem, is that most is done on men or postmenopausal women. And then there's this huge gap in between where it's like, okay, this doesn't necessarily apply to me then. I don't know if you follow Stacey Sims at all, but she always says women are not small men. I love that, because it's like, okay, we're not just a smaller version. We have completely different physiologies, and that's important to take into account. So back to fasting, there was no evidence in the research that showed that it was going to be bad for women, but there were a lot of researchers coming out saying, I'm a little concerned about fasting for women. Like, there were some red flags. So I was concerned as a healthcare practitioner recommending it too much to our customers. So in the beginning, I was very safe. I was like, no more than 12 hours of fasting for women a day, because I wasn't sure. I didn't want it to give a recommendation that was negative, because there really wasn't great evidence for women. And then over time, as I started to see hundreds of people's data, and even though that was our recommendation, they're still going to do fasting the way they want to do, I could start to see clear nuances. So I almost never, I probably can count on one hand, seeing a male respond poorly to fasting, either intermittent fasting or extended fast. So seems to be that the benefits outweigh any potential costs for men, but I don't see the same thing for women. So almost always like a 16-8 intermittent fasting, so at least 8 hours of fasting a day, everyone seems to respond pretty well to that. So that seems to be generally safe for most women. If you are underweight or have an eating disorder, still would not recommend any type of fasting, because that's just not a good idea, but that's a very small percentage of the population. So in general, I feel very safe now recommending like a 16-8 to most people. That seems to be kind of in line with our natural circadian rhythm and way of eating. When we start to get a eating window shorter than that 8 hours, that's when I start to see mixed results. I would say like half of women respond poorly to that, specifically with OMAD style. So 1 meal a day with women, I see a lot of mixed results. So I see some women respond well to it. And then I see some women where when they're fasting, you know, they're at 20 hours of fasting at this point, we should see glucose nice and low, like 70s, 80s, and their glucose is 110, 120.
Yeah.
That is a red flag. Like that is defeating the whole purpose of doing the OMAD style of eating. If your glucose levels are at that level and they're eating keto or carnivore, we should never really see it at 120.
Right.
So, and that was happening a lot over and over, specifically with women doing OMAD. It doesn't seem to always work for people. It seems to be that it's more of a stressor than helpful. So we have this different level of stress tolerance. All of us have a unique level of stress tolerance, but women's tend to be a little bit less than men, and then some women even more. So if you are already under a lot of stress, you know, maybe type A personality, or you have a lot of stress going on in your life for whatever reason, then usually not a good idea to make that fasting window super short, because you're putting too much stress on your body. Stress is a U-shaped curve, and we start to get to that negative stress rather easily when all these other stressors are compounding. So for the most part, I would see women who were maybe had some sort of metabolic dysfunction, like really high fasting insulin levels, or they were very overweight, have a lot of weight to lose, or maybe pre-diabetic. Extended fast seem to work really well for these women. I think the stressors from these conditions and metabolic dysfunction are more serious than the stress from the fasting. So for those women and men, it seems to be really, really helpful in getting that insulin level down and that glucose level down fast. And so it can really help fix these broken processes. But for somebody who's a normal body weight, normal standard lab values, they're trying to do, you know, a 36-hour fast twice a week, or they're doing OMAD, it's really not necessary, and it's just putting more stress on the body than it needs. So those women I'm seeing a lot of negative effects for. So it's sort of a fasting checklist. I want to make sure, you know, you're not underweight, your body fat isn't less than 15% as a woman, your chronic stress and your sleep is under control, you're not severely caloric restricting either. If you're really low calories for whatever reason, that's also a stressor. So if you're eating really low calories and doing a lot of extended fasting, not a good combination. And if you're sick, if you have some sort of infection or illness, not a good time to be doing a lot of fasting either. So it's kind of a checklist. And then 16-8, generally good practice for most people.
Awesome. Yeah, you know, something I've seen with OMAD also, you know, the 1 meal a day, that those people, it's kind of like you're trying to cram your day's worth of calories into one meal, and you kind of get used to eating a lot in that one meal, kind of almost like overeating in the one meal. Because for me to get all my day's calories in a one meal, I have to eat till I'm pretty much stuffed. I'm just not used to that. And people get kind of used to doing that at every meal, and say, you know, your willpower breaks down. Because for me to do OMAD is like a ton of willpower. And you know, have the second meal. And so I see people not only like having all the stress and the elevated blood glucose from doing OMAD in the first place, but then also it's like you eventually your willpower breaks down, you have that second meal, or you just have to eat later in the day, and then they end up gaining weight. So I definitely don't recommend OMAD to women at all.
Yeah, I agree. And I think that's important to know yourself. Like for some people, I think it really simplifies decisions. They're like, I only have to eat once a day. I don't have to think about food then. And that's great. But a lot of us aren't like that. And we're thinking about food still during the day. And so know yourself. Are you the type of person who you think that this is going to be more helpful or more hurtful?
Yeah.
Again, like, you know, I think we all want to follow whatever worked for that person in hopes that it'll work for us, but you have to know yourself and your own habits and behaviors.
Exactly. And the other thing I've seen is people that have like lost a lot of weight with OMAD, you know, that's helped them get the weight down. Like you were saying, people who are just metabolically unhealthy, it can kind of outweigh, the risk can outweigh, or the benefit can outweigh the risk of doing it. But then they've kind of reached goal weight or gotten close to it, and they are not seeing results anymore. It's almost as though the body and the metabolism is kind of like revolting against the chronic fasting and that chronic stress of doing that one meal a day also. And so they're either gaining weight or they've just totally like plateaued out.
Yeah. And when our body is under a lot of stress, we're more likely to create visceral fat, which is that belly fat that nobody wants to have. And so that's easy to tap into. So our body is like, when the cortisol is always high, glucose is always high with stress, it's because our body's like, you need energy for whatever stressor is going on. So it also starts to create more visceral fat because that's easier energy to tap into. So if you're gaining fat, but you're in a calorie restriction or you're only eating one meal a day, it could be that you're overstressed for sure. I see that all the time.
Yeah. So just so I understand it, I'm kind of selfishly asking stuff now. If you have that higher, those blood sugar numbers are higher on your glucose monitor, if you're seeing them chronically in the 90s and 100s, does that mean it's going to be a lot more difficult to lose weight if that's a goal of yours? If you're chronically stuck up there, is that an indicator, or can people still have weight loss even with those higher numbers?
You can still have weight loss. It's rather complicated. So in the 90s, I'm not too concerned about. When we start hitting the hundreds in a fasting state, then it's a little concerning. Again, most of the research has been done on people whose fasting values are higher and they're also having that higher insulin level. So I really think it's important to check that too, because you want to make sure if your glucose is a little bit higher, it's still a red flag, but insulin should be lower. So it could be that natural adaptation going on, and maybe that's a good thing. Maybe it's not. I'm on the fence. The jury's out. The evidence is not clear. But you definitely want to make sure that the insulin is also low if your glucose is high. But I've had a lot of women who their glucose is high, and it's usually because of stress. And we work on stress techniques. They finally get into a meditation practice, or they're just doing breathing techniques regularly, and they lose weight. They don't change their diet or their exercise because it's already on point. And then they start to get that stress down, glucose goes down, and they do lose weight. So it's a very real connection.
Oh, yeah.
But I don't think just because your fasting glucose is high means that that's the reason you can't lose weight, but it can definitely be connected.
Yeah, it's funny. I remember when I first started yoga almost a decade ago, I immediately lost, and I was still losing baby weight, but I'd kind of stopped for a while. But I lost 20 pounds within the first month of starting yoga. And I was like, I'm not doing anything super physically strenuous. It wasn't a strenuous practice, but it was for the first time probably in my whole life, being able to find that mind-body connection, learn how to breathe properly, and then actually just like let myself relax. So I think people kind of,
I love that. Yeah. It's so
so
powerful, but it's one of those things that like people are like, oh, that's like silly, or they, push it under the rug, but it's super powerful.
Yeah. People still have a lot of misconceptions about that, and that it's woo-woo, or that it's religious, or they're going to, break some spiritual or religious pact that they have with their born or chosen religion. And it's like, y'all, that's not really the case. You can do this and it's not in conflict with anything. It's actually just going to help you. So gotta keep putting that message out there. Yeah.
I'm with you.
So I guess, do you have any other thoughts here? Anything else you wanted to talk with people out there who might be interested in, getting a CGM? What, any other thoughts, benefits that you can think of?
Yeah, I just think at the end of the day, what's really important to remember is the personalized nutrition, right? We're all different. And if you're not measuring it, you don't know. A lot of this is our silent changes, right? When our fasting glucose level is a little bit higher, maybe it's affecting your sleep, or maybe it's, spilling over into other facets of your life, but it's not like you feel it strongly. I don't know if you've experienced this, but once you've worn a CGM enough, you can start to enhance that mind-body connection. I can now tell when my glucose is a little higher. I can definitely tell when it's lower, but I couldn't do that before I was measuring the data. Yeah. And so most of the time it's this silent change that's happening. And if you're not measuring it, you don't know. I think there's a lot of noise in the nutrition world, and there's a lot of, must do this, must do that. And I think that a CGM or just data on yourself helps cut through that noise, create some sort of signal where it's like, okay, I can feel good about making this tweak to my diet, or I can feel good about doing this because I have my own data to back up what I'm doing. So that's what I always tell everyone is just, discover for yourself, but gather this data and take control of your health, because like I said, from my experience in the healthcare system, they're not necessarily going to do it for you.
Right.
So it's time to advocate for our health, especially in a time like this pandemic, when it's at utmost importance right now to really take control of it. And so I think we all need to advocate for our health right now and moving forward. And finally, the technology and all this information is available. So it's easier than ever now to do this, which is amazing. I love that this technology is available. I love that I can order this stuff from home. I know like you do the lab orders from home. That's amazing. We actually have the opportunities to do these things. So take advantage of it, because we only have one body.
I totally agree. And I love that message. And it's kind of what I try to say, on my channel and on my Instagram page, is like, we have a lot of doctors who are wonderful, wonderful doctors, have taken the research, put it out there. But at the end of the day, there's a doctor out there that says XYZ is not a problem, or XYZ is okay, but you're having symptoms, you're not sleeping, you're not losing weight, you're waking up in the night, like you're having issues. Why not get a CGM? Why not test it out and see if there's a tweak that you can make to your lifestyle or to your diet to enhance your health, to allow yourself to be more metabolically healthy. So I just love that. And where can people, I'll put a link obviously below this video for the continuous glucose monitor, so people can just click that, go ahead and order one. But where can people find you? Just through the app, or?
Yeah. If you sign up, you'll get to talk to me.
Exactly.
So NutriSense.io is where you sign up. But you can also follow us on Instagram at NutriSense.io. So most of my opinions and research findings are coming through on that Instagram platform as well. So if you want to stay up to date on what's happening with glucose or metabolism, we're putting out a lot of content there as well.
Awesome. Well, I will definitely put all those links below. And thanks again for coming on and chatting.
Yeah, thanks for having me.
So much. We'll probably have to do this again.
Definitely. Yeah, it's always fun talking to you.
Always so much more questions that'll arise, I'm sure, just from the video. So yeah, thanks again.
You're welcome. Nice seeing you.
Yeah, nice seeing you.